My name is Praneet Sharma, and I'm an interventional cardiologist. I'm a cardiologist who's trained in treatment of heart disease. I specialize in the treatment of blood vessels, including heart blood vessels, valves of the heart, as well as arteries throughout the body. Severe aortic valve stenosis is a disease of one of the valves of the heart, called aortic valve. The heart is a pump and it has valves in it. The heart pumps the blood to the body, and the valve prevents the blood from going back once the heart is relaxing. And the blood goes from the heart to the aorta and to the various parts of the body. This valve is usually the size of a quarter when it is open. This valve can get diseased, can get deposited with atherosclerosis, which is deposition of cholesterol, which gets calcified, and over time it gets narrowed to the point that it becomes almost the size of a pencil. So that decrease in the size of the valve makes the heart work harder to generate the same amount of blood flow to the body. When it gets to a critical size, the heart cannot deal with this kind of back pressure anymore and it starts failing. That's when people start experiencing symptoms. Severe aortic valve stenosis can cause 3 typical symptoms, including chest pain or shortness of breath, or also lightheadedness. Even patients pass out sometimes. Once you get to that point where you're having symptoms with this narrowed valve, that is the time that it needs treatment. They come to our office, we do an echocardiogram, which is an ultrasound of the heart, and we identify that the aortic valve is severely narrowed. Then we bring them to the hospital to do diagnostic tests. Some of the patients present directly to the hospital with heart failure symptoms or one of these symptoms, including chest pain, lightheadedness, passing out, or worsening heart failure symptom of shortness of breath. Narrowing of the aortic valve is a structural problem, and unfortunately it cannot be treated with medications. It needs surgical correction where you have to remove the valve or replace the valve with a healthier valve, which can open and close with every heartbeat. Traditionally, this has been done with open heart surgery.